Hello Abby, my name's Amy. Is it okay if I measure your blood pressure?
Yes, no problem.
The arm should be comfortably supported at the level of the heart and free of constricting clothing. Choose a cuff of appropriate size and place the centre of the bladder over the brachial artery. Ideally, the patient should be rested, and remember they should be seated or lying. Normally, the right and left arm will give a similar result. Measuring over thin clothing should not affect the reading. Palpate the brachial pulse and inflate the cuff until the pulse becomes impalpable. Note this pressure as a rough estimate of the systolic blood pressure. Inflate the cuff by a further 30 mm of mercury and then listen with the diaphragm of your stethoscope over the brachial artery. There should be silence initially and begin to deflate the cuff by 2 to 3 mm of mercury per second. Note the point at which the tapping krvnog sounds appear. This is the systolic blood pressure. Continue to slowly deflate the cuff until the sounds disappear and record this point as the diastolic blood pressure. More detail about the krvnog sounds can be found in the textbook.
Thank you.